Hi, my name is Anna Beattie and I am an oral surgeon working here in 3Dental. I'm here today to talk to you about aftercare instructions after you've had oral surgery. There are a number of different kinds of oral surgery procedures that we carry out here. We carry out tooth extractions, wisdom teeth removal, implants, sinus lifts and bone grafting, among others. If you would like to find out any further information about any of these procedures, we have that information on our website. We offer treatment here in 3Dental under intravenous sedation for oral surgery procedures, if you would like to avail of that. After you've had a procedure done under sedation, we would keep you here in the surgery for a little while after the procedure, just to make sure you're recovering well, and then we will send you home. You must have an escort with you to go home after you've had sedation, and we will tell you that the sedative drugs will stay in your system for 24 hours, and in that time period you mustn't drive a car, operate machinery, sign important documents, look after small children, or do anything important really. After you've had treatment here with us, we will talk you through some aftercare instructions so you're clear on what you need to do for the week after the surgery. A small amount of bleeding after any surgical procedure is quite normal. It would be very normal that whenever you spit out, your saliva will look a little bit blood-stained for the day or two after the procedure. If you feel like there's actively blood coming out of the extraction socket or out of the surgical site, then we'll give you some gauze and we'll ask you to dampen it a little bit, put it on the gum over where the tooth or where the surgical site was, and to bite down on it firmly for 20 minutes. This should stop any bleeding for you, but if you do have any concerns, please don't hesitate to contact us. It is quite normal to have some discomfort after a surgical procedure. Before you leave the practice here, we'll talk to you about painkillers that you might take to help deal with this. It's also very normal to have some swelling after surgical procedures, and this swelling will often worsen for a day or two before it starts to improve. Ice packs in the first 24 hours can be helpful to reduce the swelling. After a procedure, we often need to place stitches. Often these will be dissolvable stitches and they will disappear by themselves, and it often takes 2 to 3 weeks for that to happen. In some instances you will have non-dissolvable stitches, but in that case we will schedule an appointment for you to come back to have them removed. Dry sockets can occasionally occur after a dental extraction when the clot breaks down in the extraction socket. The best ways to avoid this would be not to smoke for 48 hours after the procedure, and also to keep the socket as clean as possible. Unfortunately, in some instances, despite all your best efforts, people do still develop dry sockets. If that does happen, you'll tend to experience pain that is occurring quite severely 2 to 3 days after the extraction. If you're concerned, please contact us and we will have a look, and we can always place dressing to help with the pain. It's always a possibility that you will develop an infection after you've had a surgical procedure. The best way to avoid this would be to keep the area as clean as possible. We'll give you lots of advice about using antiseptic mouthwashes such as Chlorsidol or Periokin, and hot salty water is also very useful for this. And if you can keep the area as clean as possible, it really reduces the risk of a post-operative infection. It's really important to maintain good oral hygiene after you've had a surgical procedure in your mouth. We do advise that for the first day after a tooth has come out, that you stay away from the extraction socket as much as possible. It is okay to gently brush your teeth before you go to bed that night, but then starting from the day following the extraction or the surgical procedure will get you to really keep on top of your oral hygiene in your mouth. So you should be brushing your teeth twice a day as normal, and there's no need to avoid the teeth on either side of the extraction socket or the surgical procedure. And we'll also advise using antiseptic mouthwashes on a regular basis, ideally after every meal and before you go to bed at night, to keep the area as clean as possible. We put in some local anaesthetic to numb the area whenever we're doing surgical procedures, and this local anaesthetic will still be in place whenever you leave the surgery. This can make your mouth feel quite numb, and you just need to be very careful not to bite your lip or bite your tongue, and be careful with hot drinks until the anaesthetic has worn off. After you've had a surgical procedure, we would advise that you eat some softer food for the days following the surgery. So this doesn't need to be soup. Generally, you should be able to eat things like mashed potatoes, bananas, scrambled eggs, well-cooked pasta, things like that. Ideally, you're just avoiding anything that would be crunchy or hard or would be sharp on the surgical site. It's also a good idea to avoid very hot drinks in the hours immediately after an extraction, because it can provoke some bleeding. If you've had extractions, you can start eating solid food as soon as it feels comfortable for you to do so. If you've had other procedures, I would advise you to follow the advice of your dentist, and we're always happy to answer any questions. We would advise avoiding very strenuous activity in at least the 24-hour period following a surgical procedure, because it can provoke some bleeding in the area. I would be led by what feels comfortable for you in the days following that, but at least for the first 24 hours, I would avoid very strenuous. I hope this advice is helpful, and if you have any questions, please do not hesitate to contact us.